So adaptation, as we mentioned, is a gradual change in your body. Okay, where your body needs that new demand, like elevates into the hierarchy. Okay, so one of the adaptation we have
meiosis.
የሚቀላቀል ድምፅ አለ። ሶሪ።
Okay, good. Another type of cell division is meiosis.
Sorry, ድምፅ የሚቀላቀል አለ።
Gametogenesis.
Sorry.
Next, please. So,
okay. So that in adaptation, if your body is going to adapt like the higher altitude within a few days, that's called acclimatization. Okay, that's called acclimatization. Rapid physiological changes to adapt new environment is called acclimatization. That means when your body tries to adapt the higher altitude like within 4 days, that's called acclimatization. Rapid adaptation. Okay, rapid adaptation is called acclimatization. So in order to adapt, that the higher altitude within a short period of time, the following changes should be there. Okay, so the first is increase the concentration of hemoglobin, okay, in your blood. Okay, hemoglobin is a protein found in your blood cells that carry oxygen. So its concentration should be increased. The second is its affinity. That affinity of hemoglobin to oxygen should be reduced so that more oxygen can be released into the tissue. Okay, so affinity reduction. The other is high oxygen dissociation. That means that dissociation is when oxygen is dissociated from the hemoglobin and enter into the tissue or enter into your cells. It's called dissociation. So high dissociation should be there. High, that or large amount of oxygen should be released into the tissue in order to adapt. That the higher altitude within like 4 days. Okay. The other is hyperventilation. Increase the number of breaths per minute. Okay, that's called hyperventilation. That normally we have said that we breathe 12 to 20 times in 1 minute. If you count your breath, if you are normal, it should be ranging from 12 to 20 breaths per minute. So if it is greater than 20, that's called hyperventilation. So if people are living in the higher altitude, hyperventilation is normal. Okay. Otherwise, if this hyperventilation is in a people who are living at sea level, it may be the symptom of some disease. So hyperventilation is another change in your body during acclimatization. Okay. The other is increased heart rate. That the number of the number of beats per minute. Okay, so the normal is 75 beats per minute average. That means average. Otherwise, the range is ranging from 60 to 100. If you try to count the number of beats of your heart rate in one minute, it should be ranging from 60 to 100. Below 60 is not normal. That's called bradycardia. Bradycardic, and the subject, that the condition is bradycardia, and the subject is bradycardic. Otherwise, if it's greater than 100, that's tachycardia. Okay, tachycardia, increase. Otherwise, it should be maintained between 60 and and 100. But if the subject is living in the higher altitude, and if that subject adapts that environment, the beat should be increased. Okay, the beat or the rate should be increased. Systemic vasodilation. Okay, you know, vasodilation is increase the luminal diameter of the blood vessel. That's called vasodilation. Okay, pulmonary artery constriction. You know, pulmonary artery is the blood vessel that supply blood from the right ventricle of your heart into the lung, and in the subject in the higher altitude, that artery should be narrow so that less blood is getting to the lungs, so that ventilation perfusion ratio can be correct. Okay, so these are some of the changes you expect during acclimatization, okay, in order to adapt the higher altitude. Otherwise, like we mentioned earlier, there may be altitude sickness. Okay, so if you feel, or if like for instance, if you have vomiting, headache, reduction of appetite, fatigue, and so on, in higher altitude, these changes may not there in your body. Okay, so it may be even fatal. There are researchers who passed away because of the altitude sickness. Okay, because of altitude sickness. But we are living here at sea level, but sometimes we may expose into the higher altitude, and at that condition, at that exposure, the body is expected to change some process. Okay. So in the case of homeostasis, in the case of homeostasis, we have said that organism is maintained, okay, through constancy. The subject becomes normal if the blood pressure is 37. The subject is normal if his or her fasting blood glucose level is ranged from 70 to 120 milligram per deciliter of blood. Okay, but sometimes the changed value may be important. So maintaining at a changed value is called allostasis. So there are two groups of scientists. There are some scientists who support homeostasis, and there are groups who support allostasis. But both are important. Both are important. But allostasis is very conditional. So the change not caused that. Okay. Look. The best example is increased or enlarged the thyroid gland in a people who are living in the cold environment, and secretion more thyroid hormone is important. Make that subject to adapt that cold environment. That's called allostasis. Okay, that's called allostasis. So like exposure, okay, like exposure to the stressor may need new demand. Okay, so new demand may be required, and changes should be made to fulfill the new demand. Okay, so that we can adapt. Okay, we can adapt, and that we can adapt the environment we are exposed. So allostasis is very important for adaptation. Okay, for adaptation. Okay, and there is what you call allostatic load. I mean that this is cumulative burden on your body for chronic change. Look, for instance, when you have stress for a short period of time, that stress is important. Like for instance, if you are looking at a lion in front of you, that causes stress, so your heart rate is going to increase, your blood pressure is going to increase, your exercise must become active, either to fight against or flight away. That's very important. But so these are some of the changes during that condition. But if the change remains there in your body after the new demand has removed, that is disease, that is problem, and that makes the body to pay a cost That is called allostatic load. Look, this figure 19. Okay, the allostatic load, the figure 19. So the first is normal. Okay, for instance, there is physiological response for stress, like the increase adrenaline secretion. Okay, then stress is removed, you relieve from your stress, then adrenaline secretion is get reduced back, then there is recovery. This is the normal process. But sometimes the response from your body may not sufficient. Okay, like for instance, when you have stress, adrenaline hormone should increase in your blood. Okay, so that your heart rate is going to increase, so that more blood and the nutrient plus oxygen is getting to your exercise muscle. So strong muscle contraction, so you can fight away or fight against. That's very important. But sometimes enough response may not made from your body, and that's called insufficient response. Prolonged response, if adrenaline secretion is there or maintained, okay, maintained after stress has been relieved, that is prolonged response. Unwanted prolonged response made your body damaged. Okay, like if your heart rate is increased for a week, okay, after you expose it for a lion, that is prolonged response. Okay, and that damaged your heart. That's called allostatic load, result in organ damage. In the case of allostatic load, organ may be damaged, the heart may be damaged, or other organs may be damaged, and that results in some problems. Okay, some problems or abnormalities. So you should know what is allostasis is. So allostasis is maintaining normal, okay, at a changed value based on the condition we are exposed. So if new demand is required for the subject, the changed value is important at that time. Okay, but if that is prolonged or excess, result in allostatic load, and that is result in organ damage or certain problem. Look this table 2, comparison between homeostasis and allostasis. Homeo, the same, stasis, standing, allo, different, stasis, standing. Oh, anyways, look the difference. So stability, both are important for our stability. Both are important for the organism to be normal. Okay, so in the case of homeostasis, the concept is, look, there is set point value. You know, set point value is the normal value. What is your set point value of your temperature? 37 degrees centigrade. That's called set point value. That's called the physiological value. That is called the normal value. So there is set point or normal or physiological value, and that may be changed because we are exposed to the changing factors. So your body temperature may be increased or reduced, and that is detected by the sensor. Okay, the sensor. Then your deviated or changed value, like the temperature, return back into the normal. This is the concept of what? Homeostasis. The concept of homeostasis. But the concept of allostasis is different. Okay, there may be set point value, and that may be changed into a new value, and that new value is important to fulfill the new demand of the organism. That's called allostasis. So allostasis is maintaining through a change. Okay, through changes. But homeostasis is maintaining through constancy. Okay, the goal is to maintain constancy in the case of homeostasis, and the goal is to fulfill the new demand via changes. Okay. Example, like you can see the negative feedback in the case of homeostasis, or you can see the positive feedback we mentioned earlier. Okay, in the case of homeostasis, but in the case of allostasis, there is like reproductive process of formation of new set point. Like for instance, your body temperature set point is 37 degrees centigrade. But there may be new set points that can be made in your body because of like infection. That is why still you shiver or you are shivering, yet your body temperature is high, because shivering is to increase your body temperature. So you should ask why shivering is still okay, still is there, yet our body temperature is high. You can ask such question because the set point is increased to like 40 from 37 during infection. So there is fever during infection, and that increase your body temperature to the higher value. That may tries to, I mean that damage the infectious agent that bring fever, for instance. So it is very important. But if your body temperature is increased beyond that, that can affect the parameters in your body. So the case of allostasis, you can mention heterostasis, and in the case of homeostasis, you can mention the negative feedback, the positive feedback, and the feed forward. Okay, so this is the summary between allostasis and homeostasis. Okay, then our homeostasis is very important to regulate the body fluid. Okay, the body fluid. So why we need the body fluid to be regulated with our homeostasis? Because body fluid has its function, mainly that's water. When you say body fluid, mainly water. That's in special compartment or the blood and so on. Okay, so the first function for the body fluid is transportation. Okay, transportation, like the hormones in your body or the drugs or the digestive food substance are transported in your body through the fluid, okay, or remove waste products. Like for instance, there may be nitrogen waste products like urea or the creatinine and so on are waste products in your body. Those should be get out from your body in the form of urine. Okay, so there should be fluids that transport this waste product into your kidney, and then you urinate, and you are removing that waste product. Okay, protection. The second function is protection, like lubrication. For instance, take the fluid in your brain. Okay, that's called cerebrospinal fluid. And when you are moving here and there, the soft part of the brain maybe sticks with the cranium, the skull, the hard bone, okay, and the soft part may be damaged. So there should be fluid lubricate the environment and absorb shock. Or like for instance, you can take amniotic fluid in the womb of the mother that absorb shock and protect the fetus. Okay, or you can take fluid surrounding the heart, pericardial fluid. Okay, so when the heart is contracted and relaxed, the environment should be lubricated with the fluid. Okay, so shock is going to absorb it. Otherwise, if there is no fluid surrounding the heart during relaxation and contraction, the heart may be injured. Okay, so protection is another function of body fluid. Okay, media for reactions. There are reactions in the body, and those reactions are takes place in the fluid. The other is solvent. Okay, you know the solvent. So the body fluid can be taken as a solvent, like water. Okay. The other is the body fluid is very important for sensation, like hearing, vision, and so on. Because in order to hear, there should be fluid in your ear, mainly that is in the cochlea, and that's called ocular fluid. And that fluid is very important. If that fluid is not there, you can't hear. Or there is fluid in your eye that facilitates that visual transduction. Okay. The other is the regulate body temperature. The body fluid is very important to regulate our body temperature. Like for instance, if your body temperature is increased, the blood vessels that supply blood into the surface are going to dilate. Then the probability through which the temperature is diffused in the environment is high. Or take the saliva, for instance. Okay, so the body fluid is very important to regulate your body temperature. The last function of body fluid is it can be used as sample source for diagnosis. For instance, if you suspect meningitis or inflammation of the meninges, you should take fluid from the lumbar region of your spinal cord. Then you culture that one, and you are going to get the infectious agent that infect the meninges. Okay, or if you diagnose the agent that affect your eye, you should take the discharge from your eye or the discharge from your fluid that ear, so that you are going to take that fluid and you culture it. Then you are going to identify the agents that affect your eye, your ear, and so on. Okay, so the body fluid is very important to serve as a sample source for diagnosis. You know, diagnosis is identification of the disease. Okay, and it is good to know the factors that affect amount of water in your body. So the total body water can be quantified. We'll see that one. And that total water in your body can be affected by different factors. So regardless of other factors, the following are the major, like the age, the sex, and the type of tissue. Okay. So when you get aged, the fluid, okay, in your body is get less. So look, this age group, like you can have the fetus, then that you can have the infant, then you can have the childhood, and you can have adult and so on. So more fluid is found in the fetus, then in the neonate, then infant, and so on and so on. So this indicates that when you get aged, amount of fluid in your body is get less, because the fluid is replaced by other components like the fat or other components of your body. The other is sex. So when you see sex, more water is found in male than the female. So that 60% of the total body weight is water in male and 50% is in the female. And that may be attributed to different factors, and you can mention the steroid hormones. Okay, so more fluid is found or more water is found in male, okay, than the female, and more fat is found in the female than male. So the amount of fat variation between males and females may attribute to water the total water amount between the sexes. Okay. The other is type of tissue, like the lean tissue and the fat tissue, so that the lean subjects who are lean, have more water than the fat or the obese one. Okay, and you can quantify the amount of water found in your body. Okay, so if you are male, okay, you can multiply your total body weight by 60%. So take, if you are for some 70, if you are a man with 70 kilogram, then you can determine how much water is found in your body. Okay, and that's around 42 liters. Okay, but if you are female, you multiply your the total body weight with 50%. Okay, so assume there is a man with 70 kilogram weight, the total weight, then the total water is 42 liters. So where that is found in your body? You should ask that one. Where water is found in your body. So there are compartments, and these are two compartments, the two major compartments: intracellular compartment, okay, and extracellular compartment. And you can have fluid inside the cell. That means intracellular compartment is the cytoplasm, or you can say inside the cell. So the fluid inside the cell is called intracellular fluid, and that is 2/3 of your total body water. Okay, 2/3. So that if you are a man with 70 kilogram, and if your total body water is 42 liters, then you multiply 42 by 2/3. Okay, then okay, and 1/3 of the total body water is found outside the cell, and that is called extracellular fluid, and the compartment is extracellular compartment. Okay. Then there is what called interstitial fluid. Okay, there is interstitial fluid. I mean that the extracellular fluid can be again categorized into, or the fluid outside the cell may be found in the tissue. Okay, that's called tissue fluid or interstitial fluid, or the fluid outside the cell may be found in the blood vessel. That's called intravascular fluid, like the plasma, or the fluid found outside the cell may be found in certain compartments, and that fluid is called transcellular fluid, like the lymph. Okay, cerebrospinal fluid, ocular fluid, the fluid in your eye, in your ear, or the synovial fluid, the fluid found in your joint. Okay, and peritoneal fluid, the fluid around the gyre, pericardial fluid, the fluid surround the heart, which is very important to lubricate the environment where the heart is contracted and relaxed. That's called pericardial fluid. And there is fluid that surround the lung, and that's called pleural fluid. So collectively, these are transcellular fluid, and these are 1/20 of extracellular fluid, or that is 0.5 liter. Okay. Otherwise, plasma or intravascular fluid is the next in amount. That means, for instance, if your extracellular fluid is 1/3 of total body fluid, then you have amount, and you multiplied that 1 by 3/4, then that fluid is called the tissue fluid. But if you multiplied your extracellular fluid by 3/14, that's called intravascular fluid. Okay, and this proportion should be regulated. Okay, so the amount of fluid inside the cell should be 2/3 of your total body water, and the amount of water found outside the cell should be maintained, and that should be 1/3. Okay, even though there is fluid shift between the two compartments. Actually, we'll see there is fluid shift in such a way that water can get into the cell or leaves out the cell into extracellular compartments. Okay. Otherwise, if this proportion is not maintained, there may be like flaccid. If more water is left out from the cell is going to shrink, and that's called flaccid. Or if more water is entered into the cell, that may increase the fragility of our cell, like red blood cells, and that's called the turgidity, or the turgidity is going to increase. Okay. The other thing, what we should know is variation. Okay, protein variation between the tissue and the plasma. Where do you think more proteins are found, in the tissue or in the blood, is the question. Okay, so the answer is more proteins are found in the blood or in the plasma than in the tissue. Okay, and most of the proteins, those are found in the blood, okay, are negatively charged. Okay, negatively charged. So if those proteins found in the plasma are negatively charged, so they can attract the cations, because unlike charges attract each other. So more cations are found again in the blood than the tissue. So more sodium is found in the blood than the tissue. More calcium found in the blood than the tissue. And this effect is called the Donan effect. So Donan effect is the effect of protein, okay, those found in the plasma than the tissue can attract, okay, the cations, so that more cations are found again in the blood than in the tissue, and that's called Donan effect. So you should know what does mean the Donan effect. Okay, you should that explain behind the Donan effect. Okay, the other thing what we should discuss is variation between extracellular and intracellular fluid. Okay, so there is variation in amount. Actually, we have seen that one, or we discussed that one, so that more fluid is found inside the cell. Okay, and less fluid is found outside the cell. So that is one variation. But the two fluid, the two compartments, or you can say the two found, that vary in composition. Okay, so that more sodium more sodium, calcium, chloride, bicarbonate are found outside the cell. So more sodium, like if you see amount of sodium is 12 times higher in extracellular fluid, like in the blood, than in the cell. That's why sodium is called extracellular carbohydrate. But more potassium, magnesium, phosphate, sulfate, some proteins are found inside the cell, or more. This the concentration of this components is high in the intracellular fluid than extracellular fluid. So more potassium is found inside the cell. So potassium is called intracellular cation. Otherwise, if you see the pH extracellular fluid, like if you see the blood is a little bit alkaline, because the pH of the blood, the average one, is around 7.4, a bit alkaline. That is greater than 7. But intracellular fluid pH value is around 7, so that is neutral. Okay, that's neutral. That is osmolarity. And the osmolarity between the two compartments is almost the same because of the fluid shift between these two compartments. Okay. Okay, and we have said that there is a fluid shift between the blood and the tissue. Okay, and there is still fluid shift between the intracellular and extracellular compartment. Okay, that means the amount of fluid in the blood can affect the amount of fluid in the tissue, and the amount of fluid in the tissue affects the amount of fluid in the cell. So one can determine the other because of the fluid shift between different compartments. Okay, so what pressure, okay, facilitates the fluid exchange between different compartments, and there is force, and that force is called the starling force. Okay, the starling forces. So the starling forces, like the hydrostatic and osmotic pressures, are very important to facilitate the fluid shift between different compartments. Okay, so look this figure, figure 21. Is a blood vessel, and that is actually capillary. Okay, where materials are exchanged between the blood and the tissue. So first of all, you can have arterioles, the smallest artery, and the smaller artery. Then you can have the capillary, and the capillary has two ends. Okay, the first and the last end, or the arterial end of the capillary and the venule end. So in the arterial end of the capillary, there is filtration. Fluid is get into the tissue from the blood vessel. So in this end, you can have PC, okay, or that's called capillary hydrostatic pressure, and that is 35 millimeter mercury. And you can have PC, and that's called colloidal pressure, that is 28 millimeter mercury. That's the average value. Okay. And at the venous end of the capillary, you can have PC, okay, or that's called the hydrostatic pressure, 15. So why do you think the hydrostatic pressure at the capillary end is 15? It was 35, now is 15. The reason is because fluid is get into the tissue, okay, from the capillary. Okay, that's why the hydrostatic pressure at the venous end of the capillary is less than the hydrostatic pressure found at the arterial end of the capillary. Okay, so you can have capillary, okay, capillary hydrostatic pressure, capillary colloidal pressure, and you can have PI. PI is interstitial hydrostatic pressure, and that is almost negative 3 millimeter mercury. So negative pressure, that attract, okay, not that drive substance to get into another compartment through the negative pressure. That's impossible. And you can have pi I, or that's called colloid osmotic pressure, that is in the tissue, which is very less, okay, because we have said that more proteins are found in the blood, not in the tissue. That is why the collodion coating pressure in the tissue is 8, and the collodion coating pressure in the blood is 28, because capillary may not allow to pass large size proteins from the blood into the tissue. Okay, so that more proteins are found in the blood or in the plasma than the tissue. So calculate the net filtration pressure from these pressures. Okay, so filtration is at the arterial end of the capillary. So in order to determine the net filtration pressure, you should know that which of this pressure facilitates filtration, okay, and opposes filtration. So hydrostatic pressure at the arterial end facilitator, and the oncotic pressure opposer, okay, because proteins or electrolytes drag water into a given compartment, not allows water to get into another compartment. So capillary colloid oncotic pressure is opposer, okay, and the tissue hydrostatic pressure is opposer, but it's negative, okay, and the tissue oncotic pressure is facilitator. So the net filtration pressure is equals to facilitator minus opposer. Then you'll have the net filtration pressure that drive fluid to get into the tissue from the blood. Okay, so collectively the pressure and that the pressure contributed by this 4 pressure is contribute for the starling force. Okay. The other thing, the fluid, in order to the amount of fluid in the body to maintain constant, the intake fluid and the output should be balanced. Okay, the intake and output should be balanced. So you can have intake like fluid ingested. Okay, the intake source can be fluid ingested, like drinking of water or other fluid, or from metabolism. Actually, very small amount of fluid is produced during metabolic activity. Okay, so you can have the total intake fluid and you can have the output. So the input and the output should be balanced. Otherwise, if the input is greater than the output, that is result in hydration or sometimes edema. Okay, or if the output is greater than the input, that results in dehydration. Okay, dehydration, which is again can be either hypertonic, or isotonic dehydration. We'll see that one. Okay, so if there is fluid in the body, and if that fluid is found in 2 compartments, and you have said that the amount should be maintained, what are the components involved in fluid regulation? At least you should know that what components are involved to regulate the amount of water found in your body. At least you should know that. Okay, so the first are the sweat glands, then the kidney, okay, the kidney in the nervous system, and the hypothalamus of your brain, okay, that contains the trust center, and that can secrete antidiuretic hormone or vasopressin. Okay, so this antidiuretic hormone normally reduced excretion of water. Diuresis is excretion of water. Anti is opposing that process. So when antidiuretic hormone is high in your body, then less water is excreted out. And you should know that antidiuretic hormone is produced when the plasma volume is get less. Like for instance, if your blood the plasma volume is reduced by 10 to 15%, then hypothalamus start to send a message into the posterior pituitary gland so that antidiuretic hormone is going to secrete into the blood, and that antidiuretic hormone is getting to your kidney. So there is beta receptor in your kidney, and through that receptor, antidiuretic hormone increase reabsorption of water or reduce excretion of water. Okay, so water in your blood is going to increase. The other is increase in the plasma osmolarity. Okay, increase the plasma osmolarity is another factor for the secretion of antidiuretic hormone. We are listing down factors, okay, contributed to antidiuretic hormone secretion. So the second is increase blood osmolarity. So you know the normal blood osmolarity, that is around or around 280 to 300. That's the normal. But when the osmolarity is increased 1 to 2%, okay, then antidiuretic hormone is started to release into your body. The other is drying of the GI, drying of GI. Like for instance, drying of your mouth. If you are not going to take water for some time, like your mouth or the stomach or other GI structure may get dry, then messages get into the brain from this drying structure. Then antidiuretic hormone is start to produce and get into your blood and then get into the target area. So that the last is reduction of your blood pressure. When your blood pressure is reduced or when your blood volumes get less, antidiuretic hormone is started produced. The other is angiotensin and angiotensin 2 and increase the concentration of sodium plus the sympathetic nervous system. So these are some of the factors facilitate for the secretion of antidiuretic hormone. You can add more. These are not only factors that facilitate the secretion of antidiuretic hormone. So we mentioned some of them. You can add more factors. Those increase the secretion of antidiuretic hormone. The last is ANP or atrial natriuretic peptide. This is the hormone that antagonizes the effect of aldosterone, so that this ANP or atrial natriuretic peptide increase excretion of sodium. So this hormone should produce when sodium in the blood gets high. Okay, so when sodium gets high in your blood, sodium has osmotic effect so that it can drag water into a given compartment where that sodium is. So the blood volume is increased. So more blood is getting to the heart, okay, into the right atrium, and there may be that distension, and that distension is changed by low pressure baroreceptor found in the heart. Then ANP is produced, and that ANP increases excretion of sodium. Okay, are you there? Hello, guys. Are you there? Okay, sorry. I think it is better to stop here because we use our time. Okay, so that we'll continue tomorrow. Okay, so that we'll see the remaining slides, and then we discussed about the physiology. So if you have some question, you can write in the chat so that I will summarize and we'll discuss tomorrow. Any kind of question. Okay, you can write in the chat box. Okay, then I will see your question and I will summarize. Otherwise, it is better to stop here and have a nice time.